Thank you. I would like to ask for the full 15 minutes.
You got 15 minutes. Just
Okay.
just focus on what we're trying to.
I will, but
I don't like being the mean chair, but you
understand.
just got to be focused, and that's what we're trying to do. So,
absolutely.
Go
I
ahead.
understand you've heard this issue many times before.
Yeah.
So I will focus strictly on the referendum. Some points may take you a second to see how it's going to reflect, but it will. My name is Alex. I'm a director here in the city of San Diego. I'm grateful to be speaking on behalf of the Patient Care Association of California. Our organization, along with Citizens for Patients' Rights, is the reason this qualified referendum is here before you today and why the decision is now in your hands. Our association is a democratic organization of over 60 participating local San Diego city collectives that have come together to provide a voice for the medical marijuana community. A voice that I must say has been much needed in this city. And not just to communicate our perspectives and concerns to the local politicians and regulating agencies, but also to strengthen the evolution of our community. Our community that is coming out and dealing with the consequences of over 70 years of disinformation and propaganda against the medical uses of cannabis. The reality, as expressed before, is that there is not one of you up there in this room that doesn't know somebody that wouldn't be impacted by the loss of access to medical marijuana, whether you realize it or not. And that's exactly what, unfortunately, this law threatens to do. It threatens to impact the most vulnerable in our society. The sick, the disabled, the elderly, the poor, and coincidentally, these are the same individuals being so barbarically impacted by the cuts to social services and health care as a result of the current economic situation. And now their alternative means to treating their own health has been undermined, and this is why we are all here today. I am honored here today to be speaking on behalf of our participating collectives. But I am empowered, however, by the 70,000 to 90,000 San Diego residents that are members of our collectives. I'm empowered by the 44,000 individuals that signed the referendum and support our efforts. And I'm empowered by the millions of California voters that 16 years ago voted to allow the use of medical cannabis for its citizens. For me, personally, this ordinance is bittersweet. Bitter because since the day the law was approved by the City Council, and in fact before, as it proceeded through its bureaucratic procedures, grief, stress, and uncertainty have plagued our community. The future of the collectives legally organized under state law was in jeopardy. And the hardest part, I'm sure, for most people to grasp is that this means the manner of health care organized by 70 to 90,000 people here in San Diego has been seriously threatened. I doubt that any of you here are still unaware that this ordinance amounts to the shuttering of every collective here in San Diego, with only the possibility of a few mega collectives opening years down the line. You've been advised of this, that this ordinance is in fact a de facto ban by your very own advisory council for the issue. The Medical Marijuana Task Force, commissioned with the sole intent of providing you recommendations for regulating collectives here in the city, which spent over 6 months meeting with the members of the public, with city planning groups, reviewed dozens of ordinances from other California cities and counties, expressed their opposition to this ordinance verbally and in writing by the 7 letters sent from 7 of those 11 task force members. So why is there any reason for anything but a repeal of this ordinance? An ordinance that clearly amounts to a de facto ban that clearly threatens safe access to medical cannabis for the residents here in San Diego. Is it because you doubt the medical use of marijuana? This argument has been put to bed. Aside from the 5,000 years of documented use and benefits dated from ancient Eastern sages, we have modern science today providing mountains upon mountains of evidence of the medicinal uses and the medical properties of this miracle plant. Even the federal government is on its heels with the release just a few months ago from the National Cancer Institute, which is part of the U.S. government's National Institute of Health, acknowledging the medical use of cannabis. It's hard for the federal government to justify marijuana is a drug with no medicinal benefit when its own federal health agency says it does. So is it because you believe that collectives are a danger to the community? That's been said a few times here. And every statistic ever presented in these chambers, and I've heard them all, has been outright false, grossly misstated, hearsay, or presented out of context. Often appealing to ignorance, irrelevant authority, it's a red herring, or any other logical fallacy. And in fact, actual evidence has been offered demonstrating the opposite via testimonials from neighbors, letters from landlords, showing statistics about the reduction of crime when collectives enter a neighborhood. And collectives are one of the few establishments that have charity as a core element of their operating models. Food and clothing drives, street cleanups, free health services such as massage, acupuncture, and chiropractic services for their patients, monetary donations to shelters, donations for natural disasters, you name it, a collective is doing it today. So, a danger to the community? In fact, the opposite. We are building community. And is it because you maybe think that healthy people are using medical marijuana? Another thing expressed in these chambers. All we have to do is look at this logically. Unless you're a physician, and unless as a physician you have evaluated these patients, you are in no position to judge an individual as healthy. If you have not realized, this is a nation of 350 million citizens, and last year in 2010, 4 billion prescriptions were written in this country. This is a very sick nation. The government's National Institute of Mental Health currently states that 1 in 4 Americans have a diagnosable mental disorder in any given 12-month period. 1 in 4. Important to note that the doctor's recommendations for medical cannabis are also valid for no more than a 12-month period. What's most disheartening about this statistic, and it's available on the website right now, is that the average age of onset is 14. So the next time you look at 18 to 25-year-olds walking out of a collective and pronounce them to be healthy and not in need of medicine, please remember the reality of the prevalence of these disorders in our society and how incredibly debilitating stress, anxiety, depression can be for these individuals. And so, any option other than repeal, it's obviously not because your constituents want collectives gone. In less than 30 days, 31,000 valid signatures were submitted to qualify this referendum. Furthermore, in 2009, a poll was conducted that found over 2/3 of San Diego residents are in favor of medical marijuana collectives with regulation. That same survey found that only 9% wanted an outright ban on collectives. And the few voices you hear this afternoon in outright opposition are the remnants of that 9%. As the discrimination and the ignorance around the issue is assuaged, their opposition will only soften further. Because in truth, we are compassionate people. I haven't met one collective director that is a money-hungry corporate elitist. These are working-class individuals, your constituents, that are honored to be providing natural health services to members of their community. Community members that we build bonds with, develop relationships with. We could share endless stories with you that would bring tears to your eyes. That would make you instantly understand how vitally critical this medicine is and how it could turn someone's life completely around when nothing else could. And to explain that a law was passed that amounts to the shuttering of every collective in San Diego, those were conversations nobody should have had to have. Please realize that in an urban city, most people don't have a green thumb. And oftentimes, there's physical limitations in the environment that inhibit someone's ability to produce their own medicine. So for many, this meant complete loss of access, or at least forcing people to attempt to obtain their medication via dangerous avenues such as the street, which only proliferates the black market. That's fact. So the collective directors, after this law passed, got organized, motivated and committed to ensuring the sustainability of our medical cannabis community, and that's why we are here before you today. Mr. Gloria, if I asked you, could you see the benefit in revisiting this legislation with an association of collectors that could offer valuable and legitimate perspective on the proposed regulations and its impact on safe access, could you deny the benefit? Could you?
There's no back and forth.
Okay, oh yeah. It's fine. The answer is clear. There's obvious benefit. So how can we justify spending nearly $1 million by putting this ordinance on the ballot when firefighters and police are being laid off, when library hours are being cut, when public services are being eliminated? How can we justify proposing an ordinance that immediately eliminates the millions of dollars in tax revenue that collectives provide to the state and local governments, which immediately threatens loss of rents for property owners, that eliminates just within our 60 collectives the employment of nearly 1,500 individuals directly and indirectly, which eliminates access to medicine for over 70,000 to 90,000 residents in the city of San Diego? None of that makes sense, especially as Mr. DeMaio pointed out that none of the costs and logistics of actually implementing this ordinance are known. It makes no logical sense. I did mention earlier in the speech that this ordinance was bittersweet, and I explained the bitter part, but not so much the sweet part. And I sincerely appreciate your attention throughout thus far. What has been so sweet is the manifestation of this association and all the beauty that accompanies people working together to overcome a crisis. And I must say, it may never have happened had it not been for this ordinance and the crisis it created. So while we are placing this pressure on you and placing our grievances upon your doorstep, our efforts are in no way personal against you. We recognize the pressure of your responsibilities and reviewing the 1,001 agenda items on a regular basis and formulating opinions on laws is no easy duty. So to be absolutely clear, we are not fighting back against regulation. We are in fact, in this particular matter, just fighting for our existence. And what else would you expect of us? And if this ordinance is offered to the ballot, we will defeat it there as well and end up right back where we started. So we, the Patient Care Association of California, agree that regulation is necessary. In fact, it's expressed in our mission to raise industry standards, to self-regulate things like advertisements, quality control standards, and so forth. And what we are offering now is exactly what we would expect to be welcomed by the elected officials in a democracy: the participation of those impacted by the laws that govern them. We are asking that the council vote to repeal this ordinance, revisit its design amongst your committees with the participation and feedback from the Patient Care Association of California, a much needed voice that was lacking before, not because you didn't want it, but because it didn't exist until now. And now it's here, and it's very strong. And please remember that while you may only hear from an assembly of people here this afternoon, we represent thousands upon thousands. And what we need more now than ever is unity. Unity between the public and their elected officials. Unity to work out this critical issue in a manner that addresses the needs of the patients and in a manner that addresses and benefits the community of San Diego. And this can happen quickest with a repeal of this ordinance. Thank you.
Thank you.